Typhoid fever is a potentially life-threatening illness caused by the bacterium Salmonella typhi. This bacterium was originally isolated in 1880 by Carl J. Erberth and is a multi-organ pathogen that inhabits the lymphatic tissues of the small intestine, liver, spleen, and bloodstream of infected humans. Salmonella typhi is a motile, facultative anaerobe that is susceptible to a variety of antibiotics. It also has various characteristics that make it an effective pathogen. This bacterium can produce and excrete a protein known as invacin that allows non-phagocytic cells to occupy the bacterium where it is able to survive intracellularly. Also, Salmonella typhi is able to prevent the oxidative burst of leukocytes, making innate immune response unsuccessful. Salmonella typhi can enter the body through ingestion of contaminated shellfish. The most common source of infection, however, is drinking water tainted by urine and feces of infected individuals. Once ingested, the organism can multiply in the small intestine over the period of 1 to 3 weeks. Then it will break through the intestinal wall and spread to other organ systems and tissues. The innate host defenses do little to prevent the infection due to the inhibition of oxidative lysis and the ability to grow intracellularly after uptake. Roughly 400 cases occur in the United States each year, with the majority of infections acquired internationally. Typhoid fever is very common in the developing world, with about 21 million annual infections.
Symptoms. Symptoms usually appear 1 or 2 weeks after the infection, but can take up to 3 weeks to appear. The symptoms are usually persistent high fever that starts low and increases daily, often as high as 104 Fahrenheit. Dehydration, weakness, stomach pain, muscle pain, vomiting, loss of appetite, diarrhea or constipation, and some might even have a rash of flat rose-colored spots, and the symptoms may worsen if left untreated. Diagnosis. The diagnosis is determined by a sample of stool or blood test for the presence of Salmonella typhi. An ELISA urine test could also be performed, and it also looks for the bacteria Salmonella typhi. A platelet count can be done, and the platelet count may be low. Also, they will conduct a detailed and medical travel history to determine your exposure to the bacteria.
Treatment for typhoid fever. Typhoid fever is treated with antibiotics which kill the Salmonella bacteria. Several antibiotics are effective for the treatment of typhoid fever. Some of them are chloramphenicol, ampicillin, or amoxicillin. There is usually improvement in 2 days and recovery within 7 to 10 days. Prevention for typhoid fever. For those traveling to high-risk areas, there are 2 vaccines available. One is an inactivated vaccine injected in a single dose about 2 weeks before exposure. The second one is a live, attenuated vaccine which is given orally in 4 capsules, with 1 capsule to be taken every other day. Neither vaccine is 100% effective, and they require booster vaccines since effectiveness diminishes after several years. Because vaccine will not provide complete protection, you should wash your hands frequently, since hand washing is the best way to control infection. Carry an alcohol-based hand sanitizer for times when water is not available, and avoid drinking untreated water.
You guessed it, I'm Salmonella, Ella, Ella, yeah, I'm Salmonella, Ella. Ella, 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 yeah, 'cause I'm salmonella, Ella, Ella,